Wilujeng Enjing. Selamat pagi, Bapak Ibu. Good morning, Your Excellencies, Honorable Chairs, experts, and fellow colleagues from the G20 members, invited countries, and also international organizations. I am Andrew. On behalf of the Ministry of Health of Republic of Indonesia, I would like to welcome everyone to Jakarta to the first meeting of the Health Working Group, Harmonizing Global Health Protocol Standards. Thank you. Before we start the meeting, I would like to announce several informations regarding the event protocol for those who present in person. For the first one, medical concern. If you feel unease, unwell, or you have another medical concern, we have a clinic that located in the Arjuna room that you can find near the receptionist, just near the stairway. For the second one, regarding the relay, if you come with more than 4 delegates in your delegation, those persons can go to the relay room, including with the observers that located in the Agung room, for the overflow room. For the third one, ID card. All delegations must use the ID card when you go to the venue, so you can go in and get out from the plenary room and also to the others room. And please make sure that all of the committee could see your ID card. For the fourth one, it's about the meeting venue. We only have 2 doors here in the central to go in and to go out. If you want to go to the restroom, please just go to the exit door and you can find the restroom just near the exit door. For the last but not least, we will hear the safety briefing from the Hyatt Regency hotel staffs. From the security team, Bapak Rian. Bapak Rian, the floor is yours, Pak Rian.
Good morning, ladies and gentlemen. Welcome to Hyatt Regency, Jakarta. Please allow this opportunity. I am Rian from Security Hyatt Regency, Jakarta. Please pay attention for a moment to deliver a briefing on emergency procedure and COVID-19 safety protocol at Hyatt Regency, Jakarta. We really care about the health and well-being of our guests and employees. We follow the health protocol from the government and also from Hyatt Corporate. Currently, we are in the Ballroom Hyatt Regency, Jakarta. This room is equipped with a heat detector, water sprinkler, emergency light, paging system, CCTV, and also a fire extinguisher and fire hydrant. In an emergency, there will be an emergency siren and a notification from our paging system. Please stay calm and don't panic. If there is an evacuation request, please leave this room immediately to the assembly point. From the main door of this room, exit to the lobby, then turn left, follow the path. You will arrive at the assembly point in the employee parking area. Our staff will get you to the area. In order to maintain your safety and health, we have sterilized this room with a disinfectant. We have sanitized table and stationery. Door handles, water faucet, and toilet flusher are sanitized every hour. We expect you to always wear a mask and keep your distance during meeting and also will in the hotel area. Wash your hands frequently or use hand sanitizer. Thank you so much for your attention and have a successful meeting.
Thank you so much, Bapak Rian from the security team of the hotel. After this, we would like to welcome our co-chairs, Dr. Maxi Rondonu, the Director General of Disease Prevention and Control, alongside Bapak Setiaji, the senior staff to the Health Minister of Indonesia for Health Technology. Without further ado, for the co-chairs, we invite you to proceed the meeting. Thank you.
His Excellency Minister of Health of Indonesia, Bapak Budi Gunadi Sadikin, colleagues, distinguished delegates, welcome to all delegates, G20 members, and invite both physically and virtually to the first G20 Health Working Group. We are now in Jakarta, a beautiful city known for its cultural heritage, especially the Candi Prambanan. I hope all delegates can enjoy your stay here. This morning, we are honored to have with us the Minister for Health of Republic of Indonesia, His Excellency Bapak Budi Gunadi Sadikin. My name is Maxi Ronulu, the Director General for Disease Prevention and Control in the Ministry of Health of the Republic of Indonesia. Together with Mr. Setiaji, who serves as the Special Advisor to the Minister for Health Technology, will serve as Chair and Co-Chair in this first Health Working Group. Colleagues, after partial reopening borders during this pandemic, some of us, many have faced confusion during arrival, especially regarding health travel documents that are needed for verification. To further support the start of international mobility during the pandemic and at the same time to also reduce public health risk, many countries have implemented health cross-border document. However, we face challenge when countries do not share common health protocol standard for cross-border travel, which leads to less effective. Seeing the importance of the issues, Indonesian G20 presidency put it under one of our priority issues under the Health Working Group, and it will be our main topic of discussion in this first Health Working Group in order to exchange views of the importance of harmonizing global health protocol standards and finding ways to facilitate global mobility. Colleagues, to kickstart our meeting today, the Minister for Health, Bapak Budi, is here to give welcome remarks and to share his perspective on this particular issue. Without further ado, allow me to invite the Health Minister to give his remarks. Bapak Budi, the floor is yours.
Honorable delegates, distinguished speakers, ladies and gentlemen, the world is a place of interconnectedness. Our lives and well-being are inextricably linked by millions of invisible threads, genetics, neurons in our brain, friendships, businesses, and the list goes on. Along these fibers and connections, our actions run as causes, affect one another, and return to us as results. COVID-19 has separated us physically, and yet it has not stopped us from working together, building a world anew, a safer place to be. I have to admit I don't have any medical background. I spent my time in economics. I've seen several global economic crises. That is started usually in banking sector where I was active previously. This devastating global economic crisis currently started in the health sector. So I realized that health sector, when the response required are to reduce movement and mobility, will limit physical interactions. Unfortunately, most of the global economy is very depending on physical interactions. Economy happens because there is an exchange of goods and services, and that will be followed by exchange of values or exchange of money. And unfortunately, many exchanges of goods and services happens with physical interactions. When you go to the restaurant, you have a meeting like this, you sign the transactions, it happens physically. So if we limit our physical context, that will reduce drastically the economic activities. So for over 2 years, people were restrained from traveling. Cross-border mobility was restricted. Cities, states, and countries were forced into lockdown. Sectors such as trade, tourism, transportation, and education were heavily affected following the collapse of cross-border mobilities. To allow gradual cross-border openings, countries started to implement public health risk reduction measures on cross-border travel. However, as both authorities and travelers have to implement different health protocols that consistently changing and are disconnected from one another, it increases costs, adds complexity, and causes inconvenience. In Indonesia, the smartest high school student went to a medical school. So the smartest people are in the health sector. So sometimes I would like to discuss with them why in other sectors like immigrations, we can have a simple single document called a passport and a simple single process like an immigrations, that the movement of close to 8 billion people globally can easily done, and they understand how to do it globally. As this health sector is full with smart people, we should be able, to replicate those successes that has been invented and implemented by the other sector that doesn't have as many smart people as this sector. So ladies and gentlemen, infectious disease do not respect international boundaries. I know we have different in geopolitical view. We have difference in economic levels. But humans everywhere are the same. Health is an issue of humanity. So therefore, this is exactly the right time that we need to work together, whatever our difference in political views and our difference in economic level. Ladies and gentlemen, as Indonesia assumes the G20 presidency under the theme of Recover Together and Recover Stronger, Indonesia takes this baton from Italy and is committed to promote global health architecture and strengthening toward future pandemic, and at the same time allowing safe international travel. And given the restrictions, the lockdowns, and the global economic downturn, the pandemic has taught us how interconnected and interdependent we are. We therefore need to work together to mutually recognize digital health informations such as testing requirements and results, vaccination certificates, and mutual recognitions of digital applications. Today, I warmly welcome you all, the delegates of G20 countries, invited countries, international organizations to get together at the first G20 Health Working Group and develop a workable solution so that any travelers could safely move from one city to another, from one country to another, to visit our families wherever they are in every corner of the world, while at the same time recovering social and economic well-being we are striving for. This meeting is done at a special region of Yogyakarta. This used to be the capital of Republic of Indonesia, a very old one. A city where visitors will find endless cultural attractions, where heritage lovers, food lovers, art lovers will find the most ancient heritage and wonders, where visitors will find Japanese utmost hospitality and traditions. So indeed, it's just a blessing to have you all with us in this room, physically and virtually. Don't forget, physical contact to see the beauty of these cities are still much better than the virtual contact using Oculus or Metaverse, however modern we are. Thanks to the global health protocol in place, we are now even more connected. And it is in our hands to connect further all the invisible threads that keeps our society alive and live together peacefully. Thank you very much for your coming. I wish you all productive sessions and memorable stay in Yogyakarta. Thank you.
Thank you very much, Papa Budi. Colleagues, I believe that the perspective from the Health Minister will further trigger our discussion for the next 2 days. Bapak Budi, on behalf of all the delegation present today, I wish to extend our appreciation for your time and guidance in the first G20 Health Working Group. Bapak masih yeah. Dear colleagues, now I invite Italy and India colleagues to deliver opening remarks and share their view as Troika countries for G20 presidency. Italy, you may have the floor. Sorry, Mr. Sylvie, we're not here. Sorry, Italy, maybe still mute. Sorry, Mrs. Sylvie, yeah, we are not here. can try. Yeah. Maybe Mrs. Sylvie, we invite delegate India.
His Excellency Budi Gunadi Sadikin, Honorable Health Minister of Indonesia, Chair of Indonesia Health Working Group, senior officials in Troika from Italy, distinguished G20 colleagues, and invitees of the G20 Health Working Group. Warm greetings to you all. It is indeed an honor for India as part of Troika to welcome all of you to the G20 Indonesia First Health Working Group at Jakarta. It feels so good to be finally sitting across each other after a hiatus due to the pandemic and appreciate each other's thought process through this G20 Health Working Group meeting. Meeting in the person accentuates a sense of G20 community engagement, fosters interaction, and supports building rapport between us. India commends the effort of G20 Indonesian presidency for prioritizing harmonizing global health protocol standards as the first priority of Health Working Group meeting. As the COVID-19 pandemic enters in its third year, it is such a relevant topic in today's time, given that international travel restrictions continue to have a severe impact on every walk of life, including many industries and sectors such as trade, tourism, education, economy, livelihoods, environment, thus creating a roadblock in our recovery to normalcy. Besides, there are multiple standards followed by different countries, such as International Civil Aviation Organization, European Union, digital infrastructure of vaccination, open credentialing, substitutable medical apps, reusable smart technology health cards, and private sector initiatives. The lack of uniformity of standards has been a huge setback for economic recovery and movement of public health workforce globally also. Building harmonized systems for the recognition of COVID-19 digital certificates at the point of entry will pave way for all of us to build back better. Chair, as the G20 leaders emphasize the importance of shared standards to ensure seamless travel for COVID-19 testing requirements and results and vaccination certificates last year in Rome, this makes this priority identified by the Indonesian presidency absolutely pertinent. In this regard, WHO has continuously engaged and urged countries through the international health regulations to not make verification of COVID-19 vaccination a mandate for international travel and to recognize all vaccines on the WHO emergency use list. Although many countries are now gradually relaxing travel restrictions while implementing risk mitigation measures for public health, a lack of uniformity in standard among these countries has limited opportunities for mutual recognition of vaccine status, testing results, and other documents. This issue has created ambiguity among international travelers, thus exacerbating expenses and reducing effectiveness of vaccine programs, resulting in cumbersome international travel. Chair, mutual recognition of vaccine certificates and harmonization of these protocols is the only approach. Every country should have a framework which will act as a guideline, a blue book, in alignment with the WHO digital documentation of COVID-19 vaccination certificates, and amend their policies according to the WHO guidelines to enable nations to digitally verify each other's certificates. G20 platform should serve as a precursor for setting these standards in bringing uniformity and interoperability to cover all aspects of health using technology. India is glad that the Indonesian presidency has aligned its health working group priorities and the side event priorities with the previous G20 presidencies, and we look forward to continuing the momentum created by the Indonesian presidency under the India's presidency. India looks forward to co-learning from the previous presidencies and the current as part of the Troika through these meetings. India hopes that in the next 2 days, we as G20 members will have fruitful peer learning experiences and engage on how best we can achieve a concrete deliverable on the first health working group priority. I would like to close my opening remarks with the famous quote of Helen Keller, "Alone, we do so little. Together, we can do so much." Thank you, Chair.
Thank you, India. Now we can try again for Italy. I hope the technical problem solved. Please, Italy. next. I'm sorry, Mrs. Sylvia. Yeah, we still cannot hear you. Maybe network not good. We will have the floor as soon as we fix the problem. Yeah. I'm sorry, Mrs. Sylvia. Yeah. Colleagues, I believe have given a summary overview of the opening remarks from India. Yeah. Now I extend the mandate to Bapak Oscar to continue the next agenda of digital documentation of COVID-19 certificate.
Thank you, Bapak Maksi. Baskoro, currently serves as a Chief Operating Officer for Digital Transformation Office of the Ministry of Health of Indonesia. And I will be moderating the first session this morning. I am honored to serve as a moderator of the first session and will be moderating the discussion later on. Ladies and gentlemen, as Indonesia take up the 2022 G20 leadership, Indonesia has proposed to focus on 3 key areas. First, building global health system resilience. Second, harmonizing global health protocol standards. Third, expanding global manufacturing and knowledge hubs for pandemic prevention, preparedness, and also risk